Many families across the country are beginning to have conversations about Thanksgiving. The question we all are asking, is it safe to get everyone together for that sacred gathering as cases of COVID-19 spike again? This week, Dr. Anthony Fauci urged Americans to consider the risks of doing so, while warning we need to double down on mitigation efforts as we move deeper into fall and winter. There now are more than 8.1 million cases of COVID-19 here in the United States and more than 220,000 deaths. So what should you expect over the next 6 months? And what have we learned from the first wave? NBC's Erin McLaughlin has our Sunday focus.
This week across the country and around the world, fear and heartache.
We are experiencing a tsunami of grief.
A wave of sorrow overwhelming the country as the death toll approaches 220,000.
We're at a critical time right now. We've got to double down on the prevention methods.
The number of COVID-19 cases surging again since the start of the pandemic in March, this time shifting to the Midwest and rural areas and on the rise in most states, setting weekly records for new cases and pushing hospitals to the brink.
We are really struggling. People are doing heroic work, but they are really getting to the point where it's going to be literally unsustainable.
In Utah Friday, one of the state's major hospitals ran out of ICU beds with potentially deadly consequences for non-COVID patients.
This is hard.
Last Tuesday, Stephanie Deer's 47-year-old sister Lori's heart suddenly stopped. She was rushed to a nearby hospital, but they didn't have the equipment to save her. Because of COVID-19, it took 2.5 hours to find her a specialized bed.
I don't know who was more scared, the doctor or me. He looked desperate.
So even though your sister has taken every precaution not to get COVID-19, COVID-19 could still have cost her her life.
Absolutely. And I don't believe people understand that. The medical system right now is so precarious.
Saturday, thousands gathered in Wisconsin to greet the president, many without masks, despite the state suffering a record number of new cases and hospitalizations.
I have a mask. I might put it on if I sit down next to somebody, but I'm healthy and I'm not that concerned about it. It's overblown.
And in Fort Lauderdale, Florida, a party in a packed bar. No masks or social distancing. The very next morning, the state reporting the highest daily number of confirmed cases in nearly 2 months, surpassing 750,000.
It's kind of crazy. It's frightening. It's scary.
Across the Atlantic, there too is extreme concern, with the number of confirmed cases yet again spiking across Europe.
Time is of the essence. Each day that passes before action is taken means more people will go to hospital and, tragically, more people will die.
Curfews and tighter restrictions announced throughout the continent, in London, Paris, Rome, and Madrid, as both Europeans and Americans worry about the upcoming holiday season and the potential it brings for further spread. Health officials say success against COVID-19 depends on individual responsibility.
How hard is this to do? How hard is this to do? It's not hard. It may feel like we're fatigued from this, but the point is we have to do these things.
And Erin joins me now live from Utah. Erin, good morning. You know, we've been told for months and months that we're kind of biding our time until a vaccine has been developed and made available. What is the status of the development of a vaccine right now?
Willie, this week we heard from Dr. Anthony Fauci about that very question. He says we can expect a vaccine soon, by the end of the year, perhaps early next year. He said that multiple vaccines are in the works, although he said that one probably won't become widely available, widely distributed until the third quarter of 2021, which is why health experts are telling me that those basic precautions, the masks, the hand washing, the social distancing, well, it's expected to be with us for some time. Willie?
As the doctor you talked to said, it's just not that hard. Wear your mask. Erin McLaughlin, fascinating report from Utah this morning. Thanks so much.